Are they mental? 50 more things to look for? Trigger warning. Viewer discretion advised. This is from the second half of the introductory chapter to the Mental Things to Look For books, available on Amazon. People often minimize the severity of mental disturbance in a family member. They may, for example, refer to the mentally ill family member as, quotes, just eccentric, just depressed, or just very intelligent and brilliant. To explain the mental struggles of a troubled family member, they may reference past abuse, or insist that it's just the drugs or alcohol used, or trauma from their military experience, etc. People are reluctant to believe that a family member's problems functioning are due to serious mental illness. Many schizophrenic people have been described to me as merely depressed. While schizophrenics are often depressed, depression should be understood as a symptom of their mental illness, not an explanation of it. Those who hear evil voices, see wicked things, are paranoid, and such, are very often miserable, as you would expect, given their distressing, psychotic experience of the world. Too often, people believe what they want to believe. But isn't it wiser instead to understand things as they really are? After all, knowledge is power, while ignorance and denial often come at quite a cost. Frequently, quotes, "I had no idea about any of this," is the response of a parent, relative, etc., who finally comes to accept the true nature of their loved one's disturbance, namely, schizophrenia. The potential harm of denying mental illness is very real. When a so-called expert is interviewed on television about schizophrenia, they are often asked if the schizophrenic person is a general threat to the community. Typically, the answer given is that the schizophrenic is no more a threat to the community than any other member of society. But anyone who has experience working with the seriously mentally ill knows that that is not true. It is not only the schizophrenic person who suffers when their mental illness goes undiagnosed, misdiagnosed, and untreated. It is also very often members of their family, and members of society at large. The untreated and floridly psychotic schizophrenic, who delusionally believes that his mother is poisoning him, or hears the devil telling him to kill his mother, may indeed end up killing her. Sometime later, after he has been incarcerated and possibly started on antipsychotic medication, he may realize that he had been delusional previously, and killed his mother for absolutely no good reason. This is the dilemma that faces the disturbed person, who acts out because of their psychotic illness. If their psychosis later remits or diminishes, they must now live with the loss and associated guilt, in addition to suffering the legal consequences, such as incarceration. Periodically, you will hear on the news about a jail inmate who hanged himself, often a schizophrenic person, I suspect. Likely, they have either begun to feel remorse for their actions and take their life, or their psychotic symptoms have persisted untreated, and in response to hallucinations or delusional thinking, they commit suicide. A friend of mine worked in the correctional system for many years. Once, he told me about a coworker who killed her child, and in a bizarre manner. This woman very likely had schizophrenia. If you kill your parent, there is a very strong chance you have schizophrenia, and, if you intentionally kill your child, you are almost certainly schizophrenic. This friend told me that the woman was jailed after the murder, had not resisted arrest, and never denied what she had done. I then asked him if she had killed herself in jail. Momentarily taken aback by the question, he answered that she had just done so, by hanging. Reports of hearing things, seeing things, feeling things touch you, having odd or bizarre thoughts, should be taken seriously, and prompt a psychological evaluation, primarily to determine whether schizophrenia is present. Treatment facility staff persons, teachers, counselors, ministers, social workers, probation officers, parents, doctors, etc., would do well to take seriously any report of psychotic symptoms. The schizophrenic person, often unremarkable in presentation at a young age, may come to behave bizarrely later, as the illness develops. Understandably, loved ones and others are often at a loss to explain the changes in the person. Confused parents wonder how their son or daughter could have been so normal, and their future so bright, yet later come to manifest poor grooming, behave aggressively, become paranoid and secretive, withdraw from others, and fail to pursue their former dreams and ambitions. Early on, there is often a reluctance to accept that major mental illness is responsible for the changes in their loved one. Certainly their Billy, their Joni, can't be, quotes, crazy, they tell themselves, so they seek out an explanation other than mental illness. Maybe it's a vitamin deficiency, perhaps the devil has possessed them. Maybe it's the street drugs they used, possibly it's just from stress, maybe from past abuse. Maybe they have post-traumatic stress disorder from their military experience, perhaps it's that crazy spouse or partner of theirs. Could it be Lyme disease, or some other undetected disease, etc., etc.? I could not possibly list all the explanations that people come up with to explain the deterioration in functioning of a loved one. Suffice it to say that when people are motivated to find a cause other than mental illness, they are generally able to do so. To illustrate this point, I will describe a young woman with whom I worked. I conducted a psychological assessment of this very disturbed person, and found that she was unquestionably schizophrenic. Only after much delay, did her parents finally come to accept that schizophrenia was the cause for her deterioration in functioning. For some years previously, her parents resisted the schizophrenic diagnosis, and her father even refused to allow her to be treated with antipsychotic medication. Without this medication, she deteriorated terribly, and came to behave even more bizarrely and psychotically. Her parents took her back to Vietnam, where they had her meet with a shaman. A shaman is a figure of importance in certain cultures, often the closest thing to a doctor, within some communities. Shamans are thought to have special powers, including the ability to heal sick people. I have no doubt that many a shaman has been presented with a schizophrenic person, and given the task of restoring them to their previous level of functioning. The shaman attempted to root out the evil force that was thought to possess the young woman. As you might expect, this was unsuccessful. Without treatment, she just became sicker and sicker. After all other explanations, including possession by some wicked spirit or evil force, were abandoned, the family came to accept the schizophrenic diagnosis. As you can see, schizophrenia is a diagnosis that is often greatly resisted. But an unwillingness to accept the true nature of the disturbance can do harm to the afflicted person and those with whom they have contact. For the period of time while this young woman was taken from one place to another, in search of a palatable diagnosis, she went without proper treatment for her mental illness, and suffered. While in an acutely psychotic state, she was certainly at risk of harm to herself and others. After receiving appropriate treatment for her schizophrenia, her symptoms and suffering diminished. While individuals, families, and society seek answers for puzzling phenomena, there is resistance to accepting certain explanations. Even though schizophrenia may be the most parsimonious explanation for bizarre behavior, an alternate explanation, one that is less satisfactory, will often be chosen. People do not want to believe that mental illness, especially schizophrenia, is the source of the problem. Until society can tolerate honest explanations, an awareness of the tremendous impact of schizophrenia on the individual and society will not be possible. When there is an acceptance of truthful explanations, human tragedies, which one hears about more days than not in the news, can be averted. From descriptions of school shooters and mass murderers, it's pretty obvious that a sizable percentage have schizophrenia. Had their schizophrenia been identified and treated, the murders might have been prevented. As with most areas of life, common sense rules in the diagnosing of psychological disturbance. If one has good common sense, one can often understand a great deal about people's motivations for their actions. Said more plainly, when someone does something, quotes, crazy, it is often because they are, quotes, crazy. Frequently, we see the inexplicable behavior of someone reported in the news or online, especially when it involves some bizarre, violent, or other newsworthy act. Next time, ask yourself, does the behavior seem crazy? If the answer is yes, then the explanation for the behavior is often that the person committing it is crazy. Countless times, a patient has been described to me by some other party, and the patient's bizarre behavior detailed. Often then, a non-psychotic explanation for the behavior is offered by them. But after I evaluate the person in question, I frequently find instead that the explanation is schizophrenia. Crazy behavior often indicates the presence of schizophrenia. Schizophrenia can be thought of as the crazy mental illness. When people form an image of a crazy person, they are likely envisioning an acutely psychotic schizophrenic. Suppose you take the lives of two young children, with whom you have no relationship. In that case, you are clearly behaving in a bizarre manner, and almost certainly have schizophrenia. And if you kill your own children, there is little room for doubt that you are schizophrenic. One should not abandon common sense and logic when speculating about the cause of the behavior of others. The most important component of treatment for schizophrenia is psychotropic medication, especially a class of medications called antipsychotic or neuroleptic medications. By identifying schizophrenia in children and adolescents, these troubled youth may then receive treatment years earlier than they might otherwise. The age of onset of schizophrenia is generally thought to be early adulthood. Oftentimes, that is the age, early 20s, when a schizophrenic person is first hospitalized in a psychiatric facility. But with a proper psychological evaluation, it is often possible to identify the condition years earlier. And as I see it, the sooner the diagnosis and treatment, the better the long-term outcome for the mentally ill person. At the very least, early identification and treatment will often lead to a reduction, sometimes remission, in the psychotic symptoms. Reducing or eliminating psychotic symptoms improves the mentally ill person's quality of life, and can avert unfortunate acting out, in response to hallucinations or delusional thinking. In the Mental Things to Look For books, I describe 100 red flags, particularly unconventional or non-traditional ones, that may signal the presence of schizophrenia. Through conducting many thousands of psychological evaluations, I have identified specific things one can look for to assess the likelihood that the major mental illness, schizophrenia, is present. By learning how to spot schizophrenia, you will less likely become a victim of senseless violence, and will be in a better position to help the mentally ill. While I cover the well-known hallmark symptoms of schizophrenia, hallucinations and delusions, my chief contribution is in identifying non-traditional or unconventional red flags. While there is no substitute for a thorough psychological evaluation by someone experienced in diagnosing schizophrenia, it is understood that a psychological assessment is not always performed. Incidentally, schizophrenia is a condition that runs in families, so better understanding one's hereditary background is of no small benefit. There will also be some who are wrestling with the possibility that they, themselves, are seriously mentally ill, and may gain insight from the information imparted. My hope is that the information contained herein helps clarify matters for people, and leads to a reduction in human suffering. Remember, nobody asks to be mentally ill. And we do the suffering individual, their family, and society at large no favor if we fail to assist its identification and treatment. Please use this information compassionately. Even the most peculiar and bizarre behavior can often be understood in terms of the disturbed person's mental illness. The mentally ill person is not evil, though schizophrenic people sometimes behave very wickedly. For more on this and to learn how to identify schizophrenia, I recommend the Mental Things to Look For books, available on Amazon.